If you are new to labor and delivery and you just want to be the best labor and delivery nurse you can possibly be, my biggest advice is to get your patients out of the bed. That is the number one thing that I think slows labor down and contributes to your patient's perception of pain. A lot of times patients will say, oh gosh, my back hurts. And I'll say, let's get into the rocking chair. And they'll, sometimes initially they'll say, no, no, no. And I have to kind of like really urge them to get up and get out of the bed. And once they do, they're always like, ooh, you're right. This does feel better. And it's going to hurt again, but the changing of positions is very, very important. I don't know how true this is. I just know that how it works for me and, what I read about when I was in nursing school. When I was in nursing school, I distinctly remember that, that the author talked about babies who were in an OP position. So in an occipital posterior position, and that the bipyramidal diameter that goes through the pelvis is largest when the baby is OP. And, as a nurse, as a labor and delivery nurse, we know that frequently when patients have a lot of back pain, a lot of back labor, that, they may have a baby that is in this position. And so, I always remembered this book from nursing school. And I always took it. I always used the information that the best way to get a baby to rotate out of an OP position where they're kind of like, and the bipyramidal diameter is so large, is to get them squatting or to get them rocking in a rocking chair. I don't usually have my patients like work out when they're at the hospital, but you can easily plant them in a rocking chair, put a pillow behind their back, and I always tell them, rock and pray. Rock and, just pray that you have an easy and safe delivery. And they're always like, ha, 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 ha. And, but they do it. And I always use the people at the bedside. If they have family members, establish a relationship with them and, keep that patient up and moving as long as possible. If your patient wants to be on a birthing ball or if the patient wants to walk around, we have telemetry units, absolutely, get them walking, get them on the birthing ball. And, personally, even if I medicate someone, I will still allow them to stay in the rocking chair as long as a family member stays right next to the patient. And I've never had somebody, fall, but just to kind of keep them moving as long as possible. And this is one of the best things that you can do for your patients. If your patient is in bed, don't keep her legs closed. I went to a hack-up course, and I'll never forget the nurse. I was a new graduate nurse, and we had to attend these classes in Houston. And the nurse said, everybody thinks I'm a miracle worker, but when I go in, the patient's legs are like this, and I just go. And she says, and the babies always deliver, and it's always worked well for me. And I always tell my patients, I'll say, okay, and leave the door open. The door's got to be open for the baby to come out. And they always laugh, and they keep the door open, so they won't close their legs. And even if you change a patient's position, like left lateral or right lateral, you can stick a couple of pillows in between their knees to kind of keep that doorway ajar so the baby can see some light and know which way to go.